Hello everyone and welcome back to the channel. I'm Dr. Dana Rabin, a board-certified urologist, and today we're going to tackle a topic often whispered about, sometimes misunderstood, but incredibly important for your overall well-being, especially as you navigate the golden years. We're talking about masturbation, specifically for men over 60, and how to do it safely while avoiding 3 critical mistakes that could impact your health. Now, I know what some of you might be thinking. Is this really a topic for a doctor to discuss on YouTube? Absolutely. My commitment is to provide you with accurate, empathetic, and actionable health information, no matter how sensitive the subject. Sexual health, including self-pleasure, is a vital component of a fulfilling life, and it doesn't diminish with age. For many men, it can become even more significant for maintaining prostate health, managing stress, and simply enjoying a healthy connection with your own body. But here's the thing, just like with any aspect of health, there are best practices and there are pitfalls. When it comes to masturbation after 60, common misconceptions and habits can inadvertently lead to discomfort, pain, or even more serious urological issues. My goal today is to empower you with the knowledge to avoid these problems so you can continue to experience the benefits of self-pleasure safely and without worry. Have you ever felt a twinge of discomfort, or perhaps a nagging concern after engaging in self-pleasure? Or maybe you've just wondered if you're doing it right as you've gotten older. Sit down calmly. You need this solution, don't you? Then don't skip. Watch the full video carefully. Like, comment, and share it on your social media. Let's dive right in. The first big mistake I often see men over 60 make is related to frequency and intensity. Your body changes as you get older. What worked in your 20s or 30s might not be the best approach now. Overfrequency or overly vigorous techniques can lead to irritation, inflammation, and injury to delicate penile tissues. This can manifest as pain during urination, discomfort in the perineum, or soreness in the testicles. Conversely, neglecting self-pleasure entirely can also have consequences like reduced prostate health and increased stress. It's about finding a healthy balance that respects your body's current state. I always advise my patients to listen to their bodies. If something feels uncomfortable or if you notice persistent pain, that's your body telling you to adjust. It's not about stopping, but about adapting. Moderation and gentleness are key. Think of it like any other physical activity. You wouldn't run a marathon without proper training and listening to your body's signals. The same principle applies here. Your sexual health is just as important and deserves the same mindful attention. Many studies indicate that regular ejaculation, whether through intercourse or masturbation, can be beneficial for prostate health, potentially reducing the risk of prostate cancer. However, the key is regular and safe. It's not about pushing limits, but about consistent, gentle activity. We're aiming for a sustainable practice that supports your long-term well-being, not a short-term burst that leads to injury. So reflect on your current habits. Are you being gentle enough? Are you giving your body the recovery time it needs? These are crucial questions. If you're ever in doubt, or if you experience any persistent pain or discomfort, please consult with a healthcare professional. Your urologist is there to help you navigate these issues with expertise and discretion. Don't let embarrassment prevent you from seeking the care you deserve. Your health is paramount. Let's delve deeper into that first mistake, the issues surrounding frequency and intensity. When I talk about frequency, I'm not suggesting there's a magic number of times per week or month that is correct for every man over 60. Your body is unique, and what feels right for one person might be too much or too little for another. However, there are general principles to consider. In younger years, the body often recovers quickly from more frequent or vigorous activity. Tissues are more elastic, blood flow is typically more robust, and the prostate gland, while still active, is less prone to certain age-related changes. As we age, however, these dynamics shift. The elasticity of tissues can decrease, blood vessels may not be as pliable, and the prostate can enlarge, a condition known as benign prostatic hyperplasia, or BPH. This enlargement can put pressure on the urethra, affecting urinary flow, and can also make the area more sensitive to irritation. When I see men over 60 experiencing symptoms like persistent penile pain, urethral irritation, or epididymitis, an inflammation of the tube that carries sperm from the testicle, a common thread often emerges: an unchanged approach to masturbation from their younger days. The sheer mechanical stress of daily, or even multiple times daily, vigorous masturbation on aging tissues can be profound. Imagine the cumulative effect of friction on skin that is less resilient, or the repeated microtrauma to blood vessels that are less elastic. This isn't about causing immediate dramatic injury, but rather the slow, insidious wear and tear that can lead to chronic inflammation, discomfort, and a heightened susceptibility to infection. The skin, for instance, can develop microscopic tears that, while invisible to the naked eye, create pathways for bacteria to enter, potentially leading to localized infections or exacerbating existing skin conditions. Furthermore, the intensity of the technique is just as crucial as the frequency. Many men develop habits over decades that involve a very firm grip or rapid, forceful strokes. While this might have been effective for achieving orgasm in their youth, it can become counterproductive and even harmful later in life. The penile tissues, including the corpora cavernosa, the spongy tissues that fill with blood to create an erection, and the urethra, are not designed to withstand constant high-pressure friction. Over time, this can contribute to conditions like penile fibrosis, where scar tissue forms within the penis, potentially leading to curvature or even erectile dysfunction. If you have a predisposition to Peyronie's disease, an aggressive masturbation technique could potentially accelerate its progression or trigger its onset. My recommendation is to shift your focus from speed and force to sensation and pleasure. Slow down. Pay attention to what your body is telling you. Experiment with lighter touches, different angles, and varying pressures. The goal is to stimulate nerve endings and promote blood flow, not to abrade the skin or strain the internal structures. Consider incorporating more gentle, gliding motions rather than purely back and forth friction. Some men find that using their whole hand or even a soft cloth can provide a more diffused and less irritating form of stimulation. It's about finding a rhythm that is both pleasurable and sustainable for your body as it is now, not as it was 30 years ago. Remember, your body is a temple, and it deserves gentle care and respect, especially as you age. This mindful approach not only reduces the risk of physical injury, but can also enhance the overall experience, making it more sensual and less purely goal-oriented. It's a shift from a performance mindset to a pleasure-focused one, which can be incredibly liberating and beneficial for your mental and physical well-being. If you're finding it difficult to adjust your technique, or if you're experiencing persistent pain, that's a clear signal to seek professional advice. Don't ignore it. Your urologist can provide personalized guidance and rule out any underlying issues. This isn't about judgment. It's about helping you maintain a healthy and fulfilling life. Your comfort and safety are paramount, and sometimes a small adjustment in habit can make a world of difference. So take a moment to truly listen to your body. What does it need? What feels good without causing strain or discomfort? This self-awareness is the first step towards safer and more enjoyable self-pleasure. And remember, consistency in gentle care is far more beneficial than sporadic, intense activity. It's a marathon, not a sprint, when it comes to long-term sexual health. Let's make sure you're running it safely and comfortably. This leads us seamlessly into the second critical mistake, which often compounds the issues we've just discussed. Now, let's move on to the second major mistake: neglecting proper lubrication and technique. As men age, natural lubrication can decrease, and the skin can become more fragile. What might have been perfectly fine in your younger years, perhaps a dry hand or a quick vigorous motion, can now lead to microtears, chafing, and increased friction. This isn't just uncomfortable, it can create entry points for bacteria, leading to infections, or exacerbate existing conditions like Peyronie's disease. I've seen countless cases where men come into my office with irritation, redness, or even minor bleeding, all stemming from inadequate lubrication. It's a simple fix, but often overlooked. My advice here is straightforward. Always use a high-quality water-based lubricant. I emphasize water-based because oil-based lubricants can degrade condoms and are harder to clean, potentially leading to skin irritation or folliculitis. Apply generously and reapply as needed. Think of it as protecting your most sensitive tissues. You wouldn't drive your car without oil, would you? Your body deserves the same care. Beyond lubrication, consider your technique. Instead of aggressive, rapid movements, focus on slower, more deliberate, and gentle strokes. Explore different pressures and rhythms. This isn't about performance, it's about pleasure and preserving the health of your penile tissue. Many men find that a more mindful approach to masturbation, focusing on sensation rather than just the end goal, can be incredibly rewarding and safer. It's about rediscovering your body and what feels good now, not what used to feel good. Remember, the goal is to stimulate, not to abrade. If you're using any devices, ensure they are clean, made of body-safe materials, and used with ample lubrication. Poorly maintained or inappropriate devices can cause significant harm. A quick wash with mild soap and water before and after is essential. This simple step can prevent a host of issues, from skin infections to urinary tract infections. Your sexual health is an ongoing journey, and adapting your practices as you age is a sign of wisdom and self-care. Don't be afraid to experiment gently and find what works best for your body now. If you're unsure about what lubricants or techniques are best for you, don't hesitate to ask your urologist. We're here to guide you through these changes and ensure your continued well-being. This isn't a topic to be ashamed of. It's a part of life and a part of your health that deserves attention and care. Your comfort and safety are my top priorities. So, take a moment to assess your current lubrication habits and technique. Are you giving your body the gentle care it deserves? Are you using the right products? These small adjustments can make a world of difference in preventing discomfort and potential injury. Remember, a little preparation goes a long way in ensuring a safe and pleasurable experience. Your body will thank you for it. And speaking of your body, let's talk about the third critical mistake. Let's dive deeper into the second critical mistake, the oversight of proper lubrication and technique. This isn't just about comfort. It's fundamentally about protecting the integrity of your most sensitive tissues. As a urologist, I frequently encounter patients who present with various forms of penile irritation, ranging from mild redness and chafing to more severe conditions like balanitis, inflammation of the head of the penis, or even small lacerations. In a significant number of these cases, the root cause can be traced back to insufficient lubrication or an overly aggressive technique. Consider the physiological changes that occur as men age. The skin, in general, becomes thinner, less elastic, and more prone to dryness. This is true for the skin of the penis as well. The natural moisture and resilience that might have protected you from friction-related injuries in your younger years are simply not as robust now. When you combine this natural aging process with vigorous dry friction, you create a perfect storm for irritation and injury. Imagine rubbing two pieces of dry leather together repeatedly. Eventually, one or both will show signs of wear and tear. Your skin is far more delicate than leather, and it deserves far more care. One of the most common issues I see is the use of saliva as a lubricant. While saliva might seem convenient, it is absolutely not an ideal lubricant for masturbation. Saliva contains bacteria from the mouth that are not meant for the genital area, and it can quickly dry out, leading to increased friction rather than decreased. It also lacks the sustained slipperiness that a dedicated lubricant provides. This can lead to a cycle of irritation, where the skin becomes inflamed, making it even more susceptible to injury during subsequent sessions. Furthermore, the enzymes in saliva are designed to break down food, not to be applied to delicate skin, potentially causing further irritation over time. This is why I strongly advocate for the consistent use of a high-quality water-based lubricant. Why water-based? Because they are gentle on the skin, easy to clean up, and compatible with all types of materials, including silicone-based sex toys and latex condoms. Oil-based lubricants, on the other hand, can be difficult to wash off, can clog pores, and can degrade latex, leading to potential condom breakage if you also engage in partnered sex. Petroleum jelly, for instance, is a common culprit I see causing issues. It can trap bacteria, lead to folliculitis, inflammation of hair follicles, and is generally not recommended for intimate use. Silicone-based lubricants are another excellent option, offering long-lasting slipperiness and being safe for most skin types, though they are not compatible with silicone sex toys. When I say generously apply, I mean it. Don't be shy. The goal is to create a smooth, frictionless surface that allows for easy gliding. And don't just apply it at the beginning. Reapply as needed throughout your session. If you feel any sensation of stickiness or increased friction, that's your cue to add more. It's a small investment that pays huge dividends in comfort and safety. Think of it as a protective barrier, a cushion between your hand and your skin, ensuring that every movement is smooth and gentle. Beyond lubrication, let's talk about technique. Many men have developed a specific masturbation technique over decades, often one that involves a tight grip and rapid back and forth movements. While this might have been effective for achieving orgasm in younger years, it can become problematic as you age. The delicate nerve endings and blood vessels in the penis are more susceptible to damage from excessive pressure. A tight grip can restrict blood flow, and prolonged, intense pressure can lead to nerve compression or even microtrauma to the erectile tissues. This kind of aggressive technique can also contribute to a desensitization over time, meaning you might need more and more intense stimulation to achieve the same level of pleasure, creating a vicious cycle. I encourage you to explore a gentler, more varied approach. Instead of focusing solely on the shaft, consider incorporating stimulation of the glans, the head of the penis, the perineum, the area between the testicles and the anus, and even the testicles themselves. These areas are rich in nerve endings and can provide significant pleasure with less direct friction on the penile shaft. Experiment with different hand positions, varying pressures, and slower, more deliberate movements. The goal is to stimulate, not to abrade or squeeze. Think of it as a massage rather than a vigorous workout. This shift in technique can not only reduce the risk of injury but can also lead to a more nuanced and satisfying experience. Many men report discovering new areas of sensitivity and pleasure when they move away from their ingrained, often aggressive habits. It's about rediscovering your body and what truly feels good, rather than just what gets the job done quickly. Furthermore, if you use sex toys, ensure they are made from body-safe materials like medical-grade silicone, glass, or stainless steel. Avoid porous materials like jelly or PVC, as these can harbor bacteria and are difficult to clean effectively. Always clean your toys thoroughly before and after each use with warm water and a mild, toy-safe soap. Proper hygiene is paramount in preventing infections. I've seen cases of urinary tract infections and skin infections directly linked to unsanitary sex toy use. Your health is not worth compromising for convenience or cost-cutting when it comes to intimate products. Invest in quality and maintain them properly. This also applies to any other aids you might use. Ensure they are clean, appropriate for intimate use, and not causing any undue stress or friction. Finally, pay attention to your body's signals. If you experience any discomfort, pain, burning, or unusual sensations during or after masturbation, stop. Don't push through it. These are your body's warning signs. Persistent symptoms warrant a visit to your urologist. Don't dismiss them as just getting old or normal. Many issues are easily treatable if caught early. Ignoring them can lead to more serious complications down the line, including chronic pain, scarring, or even permanent damage. Your sexual health is an integral part of your overall well-being, and it deserves the same attention and care as any other aspect of your health. By prioritizing proper lubrication, adopting gentler techniques, and maintaining good hygiene, you can significantly reduce your risk of injury and continue to enjoy safe and pleasurable self-exploration for many years to come. This brings us to the third and arguably most crucial mistake that men over 60 often make, which can have far-reaching implications for their health and well-being. This mistake often involves a lack of awareness and communication, and it's something I see far too often in my practice. The third big mistake, and perhaps the most insidious because it often goes unnoticed until it becomes a significant problem, is ignoring underlying health conditions and medications. As we age, our bodies become more complex. We might be managing conditions like diabetes, heart disease, high blood pressure, or taking various medications. What many men don't realize is that these conditions and the medications used to treat them can significantly impact sexual function and the safety of masturbation. For example, certain blood pressure medications can affect erectile function. Diabetes can lead to nerve damage, reducing sensation and increasing the risk of injury. Antidepressants can impact libido and the ability to reach orgasm. Ignoring these factors and continuing with practices that worked when you were younger can lead to frustration, pain, and even exacerbate health issues. This is where open communication with your doctor, especially your urologist, becomes absolutely crucial. I cannot stress this enough. Before making any significant changes to your sexual habits, or if you experience any new or worsening symptoms related to your sexual health, you must consult with your healthcare provider. They can help you understand how your current health conditions and medications might be affecting your sexual function. They can also advise on potential adjustments to your medication regimen or suggest alternative strategies to ensure your safety and satisfaction. Don't self-diagnose or self-medicate. The internet is a wonderful resource, but it's no substitute for personalized medical advice from a qualified professional who understands your unique health profile. Another aspect of this mistake is neglecting regular checkups. Many men only see a doctor when something is acutely wrong, but for men over 60, regular urological checkups are paramount. These appointments allow us to monitor your prostate health, check for any signs of urinary issues, and discuss any concerns you might have about your sexual function. Early detection and intervention are key to managing many age-related urological conditions, such as benign prostatic hyperplasia, BPH, or prostate cancer. These conditions can directly impact your ability to masturbate comfortably and safely. A thorough examination and discussion with your urologist can help identify these issues before they become major problems, allowing you to adjust your practices accordingly and maintain your quality of life. Let's address the third and arguably most critical mistake, the tendency to ignore underlying health conditions and the impact of medications. This is a nuanced area, and it's where the role of a knowledgeable healthcare professional becomes indispensable. As men age, it's increasingly common to develop chronic health conditions such as diabetes, hypertension, high blood pressure, heart disease, and various neurological disorders. Furthermore, the number of medications we take often increases to manage these conditions. What many men don't fully grasp is the profound and often direct impact these health issues and their treatments can have on sexual function, including the safety and experience of masturbation. Let's take diabetes as a prime example. Long-standing or poorly controlled diabetes can lead to nerve damage, a condition known as diabetic neuropathy. This nerve damage can affect the delicate nerves responsible for sensation in the penis and the ability to achieve and maintain an erection. If sensation is diminished, you might not feel discomfort or pain that would otherwise signal you to stop or adjust your technique, increasing the risk of injury. Additionally, diabetes can impair blood flow to the penis, making erections less firm or difficult to achieve, which can lead to frustration and potentially more aggressive and thus harmful masturbation attempts. The same applies to cardiovascular disease. Compromised blood flow due to atherosclerosis, hardening of the arteries, can directly impact erectile function. These conditions can also affect the body's ability to heal, meaning that any minor irritation or injury from masturbation could take longer to recover from or even become chronic. Then there are medications. It's a common scenario in my practice. A patient starts a new medication for a seemingly unrelated condition, and suddenly they notice changes in their libido, erectile function, or ejaculatory experience. Many medications, including certain blood pressure drugs, especially beta blockers and some diuretics, antidepressants, particularly SSRIs, antihistamines, and even some over-the-counter remedies, can have sexual side effects. These can range from decreased libido and difficulty achieving orgasm to erectile dysfunction or ejaculatory problems. If you're experiencing these side effects, continuing with your usual masturbation habits might become uncomfortable, painful, or simply unrewarding. It's crucial to understand that these changes are not necessarily a sign of a deeper, irreversible problem, but rather a direct consequence of your medication. Your doctor can often adjust dosages or switch you to an alternative medication with fewer sexual side effects, allowing you to regain comfort and function. It's a conversation worth having and one that can significantly improve your quality of life. This brings me to the absolute necessity of open and honest communication with your healthcare provider. I cannot overstate this. Many men feel embarrassed or uncomfortable discussing sexual health with their doctors, but I assure you, as urologists, these are routine conversations for us. We are here to help you, not to judge. Holding back information about your sexual health, including your masturbation practices, can prevent us from providing you with the most accurate diagnosis and effective treatment plan. If you're experiencing pain, discomfort, changes in sensation, difficulty achieving erection or orgasm, or any other new symptoms related to your sexual health, you must bring it up. These could be early warning signs of an underlying health issue that needs attention, or a side effect of a medication that can be managed. Remember, your doctor is a partner in your health journey, and providing them with a complete picture allows them to offer the best possible care. Beyond specific conditions and medications, there's the broader issue of neglecting regular checkups. For men over 60, annual physicals and regular urological screenings are not just recommended, they are essential. These appointments are not just about checking your blood pressure or cholesterol. They are an opportunity to proactively monitor your prostate health, screen for urinary issues, and discuss any changes in your sexual function. Conditions like benign prostatic hyperplasia, BPH, which is a non-cancerous enlargement of the prostate, become increasingly common with age. BPH can cause urinary symptoms like frequent urination, weak stream, or difficulty emptying the bladder. These symptoms can be exacerbated by certain sexual activities, and conversely, addressing BPH can significantly improve your comfort and quality of life, including your sexual health. Similarly, regular prostate cancer screenings, typically involving a PSA blood test and a digital rectal exam, are vital for early detection, which is key to successful treatment. Early detection often means less invasive treatments and better outcomes. Ignoring these regular checkups is akin to driving a car without ever checking the oil or tire pressure. Eventually, something is going to go wrong, and it will likely be a much bigger problem than if you had addressed it proactively. Your urologist is your partner in maintaining your urological and sexual health. We can identify potential issues before they become serious, provide guidance on managing existing conditions, and offer solutions to optimize your sexual function and comfort. Don't let embarrassment or a perceived lack of importance prevent you from seeking this crucial care. Your health, your comfort, and your quality of life are too important. Proactive care is always better than reactive crisis management. It allows for a more tailored approach to your health, ensuring that your masturbation practices, and indeed all aspects of your sexual health, are aligned with your overall well-being. So, make that appointment, have that conversation, and take control of your health. It's an investment in your future comfort and happiness. So, to reiterate the 3 big mistakes we've discussed. First, overfrequency and overly vigorous techniques that disregard the body's changing physiology. Second, neglecting proper lubrication and adapting your technique to suit aging tissues. And third, ignoring the profound impact of underlying health conditions and medications, and failing to engage in open communication and regular checkups with your healthcare provider. Avoiding these pitfalls is not about curtailing your pleasure. It's about transforming your approach to self-pleasure into a mindful, safe, and sustainable practice that supports your overall health and well-being for decades to come. Now, beyond simply avoiding these mistakes, I want to empower you with some proactive strategies to not just maintain, but truly enhance your sexual health as you navigate your later years. These are principles I discuss with my own patients, and they are foundational to a vibrant and fulfilling life. First, embrace a holistic approach to health. Your sexual health is not an isolated system. It's intricately connected to your overall physical and mental well-being. What's good for your heart is good for your penis. This means prioritizing a balanced diet rich in fruits, vegetables, lean proteins, and healthy fats. Limit processed foods, excessive sugar, and unhealthy fats. Regular physical activity, tailored to your capabilities, is also crucial. Exercise improves cardiovascular health, boosts circulation, helps maintain a healthy weight, and can even enhance mood, all factors that positively impact sexual function. Aim for a combination of aerobic exercise, strength training, and flexibility, and don't underestimate the power of adequate sleep. Chronic sleep deprivation can disrupt hormone levels, increase stress, and diminish libido. Think of your body as a complex machine. It needs the right fuel, regular maintenance, and sufficient rest to operate optimally. This holistic view means understanding that every choice you make for your general health has a ripple effect on your sexual health. It's all connected. Second, stay hydrated. This might seem simplistic, but proper hydration is fundamental to countless bodily functions, including maintaining healthy skin and mucous membranes, which are vital for comfortable sexual activity. It also supports kidney function and overall urinary health. Make water your primary beverage choice throughout the day. Dehydration can lead to dry skin, which can exacerbate friction-related issues during masturbation, and can also contribute to urinary tract problems. So keep that water bottle handy. Third, cultivate mindfulness and self-awareness. As I mentioned earlier, your body changes, and so too can your preferences and what brings you pleasure. Don't be afraid to explore. This isn't about chasing past experiences, but about discovering what feels good and satisfying in your present body. Experiment with different types of touch, varying pressures, and different rhythms. Some men find that focusing on the journey of sensation rather than solely on the destination of orgasm can lead to a more profound and satisfying experience. This self-discovery is a lifelong journey, and your sexual health is no exception. It's about being present and attuned to your body's signals, both for pleasure and for warning signs. This mindful approach can also reduce performance anxiety and allow for a more relaxed and enjoyable experience. Fourth, consider incorporating pelvic floor exercises, often known as Kegel exercises for men. While commonly associated with women, these exercises can be incredibly beneficial for men as well. Strengthening your pelvic floor muscles can improve erectile function by enhancing blood flow and nerve function, provide better ejaculatory control, and even help with urinary continence, which can be a concern for some older men. There are many reputable resources online, and a physical therapist specializing in pelvic floor health can provide personalized guidance on how to correctly identify and exercise these muscles. It's a simple, discrete practice that can yield significant benefits, and it's something you can do anywhere, anytime. Fifth, if you have a partner, prioritize open and honest communication. Sexual health is a shared journey, and discussing your needs, desires, and any concerns openly and honestly can strengthen your relationship and ensure mutual satisfaction. Aging together can bring new dimensions to intimacy, and navigating changes in sexual function as a team can foster deeper connection and understanding. Don't let assumptions or unspoken anxieties create distance. A healthy sexual relationship is built on trust, empathy, and communication. This open dialogue can also lead to exploring new forms of intimacy and pleasure that might be even more fulfilling than what you experienced in your younger years. And finally, remember that sexual health is not solely about physical function. It's deeply intertwined with your emotional and psychological well-being. If you're experiencing anxiety, depression, chronic stress, or relationship issues, these can significantly impact your libido, erectile function, and overall sexual satisfaction. Don't hesitate to seek support from a therapist, counselor, or sex therapist if you're struggling with these issues. Addressing your mental and emotional health can have a profound positive impact on your sexual health. Your mental health is just as important as your physical health, and they are often two sides of the same coin. Sometimes the greatest improvements in sexual health come from addressing underlying emotional burdens. I want to leave you with a message of empowerment and hope. Aging is a natural and beautiful process, and while it brings changes, it absolutely does not mean the end of a fulfilling sexual life. By being informed, proactive, and willing to adapt, you can continue to enjoy the many benefits of self-pleasure safely and confidently for many years to come. Your sexual health is a gift, a vital component of your overall well-being, and it's worth nurturing. Take care of yourself, listen to your body, and never hesitate to seek professional guidance when you need it. I'm here to support you on this journey, and I genuinely believe that with the right knowledge and approach, you can continue to experience pleasure and intimacy throughout your life. If you found this video helpful, if it resonated with you, or if it sparked a new understanding, please give it a thumbs up. Your likes help this important information reach more men who need it. Share it with someone in your life who might benefit from this discussion, a friend, a family member, or anyone who could use this guidance. And please subscribe to my channel for more health insights, practical advice, and honest conversations about topics that truly matter to your well-being. Your engagement helps me reach more people and continue to provide valuable, evidence-based information. Thank you for watching, for your trust, and for taking an active role in your health. I look forward to seeing you in the next video. Stay healthy, stay informed, and take care of yourselves. You deserve it. This is Dr. Dana Rabin signing off, always here to help you live your healthiest, most fulfilling life.